everybody. So, I'm Aphrodite Rose Starfire. Also, my professional resume is under Kimberly Kurtz, and I wanted to go over my professional qualifications since I am now providing medical advice and will be on a donation-based free as I travel across the landmass and explore and see the edges of the horizon. So I would like you all to know my experience, and let's get started. So my last position, it's not on my CV, was at a pain management clinic, and I worked there for about 6 months, where I saw a majority of workers' comp patients, and a majority were Spanish speaking, and they had translators, which was awesome because I could use my, I learned a little bit of a conversational Spanish, un poquito, but managing lower back issues, neck issues, slip discs, pre and post-op epidurals, and navigating the workers' comp system, which is a whole beast, recommending surgery or trying to, basically I was the almost like the social worker, where everything had to be, that was the gatekeeper. I had to go to the referral for the surgeon, I had to request the MRIs, I had to request everything through the system, and the medications. Did a lot of prescribing medications, lots of prescribing medications. So yeah, before that I worked for a little over 6 months in San Francisco, in Pacific Heights, doing hematology and oncology. So I independently evaluated and managed and treat hematology and oncology patients for 4 physicians. I conducted personalized comprehensive chemotherapy patient education teaching sessions, and I reviewed with patient and family members the treatment regimen, what to expect, the side effect management, as well as medication mechanism of action. I maintained open and direct line of communication between the patient and family members and doctors. I'm not going to read everything. I was a participation in a lot of the clinical trials for the immunotargeted newer chemotherapy regimens, which, you know, I know a lot about the new nanotechnology that we're actually bio-infusing into people. But also, so the immunologic therapy, I know a lot about chemotherapy regimens. I treated a lot of the emergent side effects of the chemotherapy. I trained the other new hire nurse practitioners. Okay. And then for a year I worked at Bosley doing minimally invasive hair transplants. I was the first ever internationally hired physician assistant for the larger corporation Adirans that's based out of Japan. And I was trained mostly in Beverly Hills, doing the minimally invasive follicular unit extraction for hair transplants. And also I'm trained in the traditional strip scalp, the strip technique. So I trained the staff on how to do the minimally invasive follicular units. It's transplanting one hair follicle 1 by 1 from the back to the front, using a micro surgical technique. Yeah. So that was really interesting and a unique skill set, and totally different patient population. I know a lot about hormones and response to skin and hair. Yeah. Before that, I worked briefly at a temporary position at a large corporate conglomerate hospital trauma center doing trauma and emergency general surgery on the inpatient floor and an operating room and emergency room, rounding on all of the trauma patients and ICU patients, clearing for C-spine, fitting collars, responding to the trauma calls in the emergency room. And then the bulk of my experience and surgical experience is doing vascular surgery with Dr. Mahegan, and I go extensively into that skill set in my reference letter video. But some things that I did not add that I do have, because that letter was written 2 years into my experience, and I was there for a total of 4 years. So I saw patients, in the clinic, and there was also inpatients on the hospital floor. So I was seeing in the office like pre-op, post-op patients. People need consultations if they need surgery, they don't know. I was also first assisting in the operating room and in the cath lab, and I was also independently doing a lot of catheter placements, like central line placements. I'm very skilled at using ultrasound for diagnostic purposes, and also gaining access into arteries and veins. So I obtained ultrasound guided percutaneous access, both arterial and venous, in the cath lab, skillfully reading angiograms and performing angioplasty and stenting, thrombectomy and failure analysis. First assist, so we did a lot of revisions. People come in the emergency room and they have had lots of surgeries, so you go in to the body and it's like an archaeological dig, because you see remnants of old surgeons and old scars, and you have to figure out what's happened to this person, because maybe they weren't conscious before they're in the operating room, and you have to take over Frankenstein, take Frankenstein's monster. First assist on the saphenous vein harvest for the cabbage procedures for heart transfer, for the coronary artery bypass procedures. So I can harvest veins minimally invasively and open. I rounded on the inpatients in the hospital, writing post-op, pre-op, admitting orders, inpatient orders, discharging patients, dictating history and physicals, performing vascular consultations, counseling family members. We played a lot of good cop, bad cop on the floor. The surgeon would kind of drop the bad news, oh, we need to amputate or whatever. And then he'd leave, and I'd stick around and, hold the hand and say, okay, do you understand what the doctor, why we need to have surgery? And answer any questions, and okay, we tried the antibiotics, they're not working, and the body's already cut off the blood flow, and so we're just finishing the job, and discuss the risks versus the benefits. Like if we leave the toe, or then it's risk of sepsis, getting your body infected. So I'm a team with a physician. That's the role I was trained to operate in. So I also saw patients in the clinic, new follow-up, post-op, pre-op patients, perform complete history and physicals, complete vascular examinations. And these are all things that I continued throughout in my chemotherapy practice and the pain management, ordering tests, seeing patients one-on-one and figuring out what's wrong with them, or how I can help them. Prescribing medications, or ordering ultrasounds, CT angiograms, MRIs. I was on call 24/7. Outpatient wound care center, performing ambulatory debridements, bedside debridements, procedures, staging wounds. I was also the clinical director for the Vein Rejuvenation Center, which focused on varicose veins and vein ablation, which is like melting the vein in a minimally invasive way for varicose veins in the legs. I was responsible for building the whole business and marketing it. So again, I have my master's degree in physician assistant studies. I graduated from Samuel Merritt University in 2010, and I had been working ever since. Part of the program is you have 9 5-week clinical rotations in specialties, and I had a strong focus in plastic surgery and vascular surgery and general surgery. Before that, I worked as a clinical medical assistant in a surgical practice, doing all the blood pressures and rooming patients and setting up for bedside procedures. So I've worked every level, including being a patient and having surgery myself and going through the actual process of going under general anesthesia, conscious sedation. I've had multiple procedures on multiple levels, which I think has added to my empathy and my capacity of being an excellent healer and clinician. I received my Bachelor of Science in Human Biology at University of California, San Diego, here in La Jolla. I've also done a 10-week metastatic cancer research internship when I was in college, doing testing genetic protein variants, cancer markers in like a microbiology lab in Detroit, Michigan for a whole summer. So I've got stories. What else have I done? I've been a TA. I've taught nutrition. I've been a file clerk. Been a customer service representative for online jewelry company. I've been a hostess. I did get my license in the state. I'm licensed. I'm nationally certified. I just became nationally certified. But the system, oh my gosh, the system is, it is what it is. So help me bust the system and really help people and help the underserved. And I'm asking for donations. And if you'd like any services, I offer private medical consultations online, donation based, and private medical history reviews. If you'd like to know what questions to ask your doctor, you need some coaching, if you have questions about a family member, you like their records reviewed or their tests reviewed by another set of eyes, a different perspective, I'd love to help you. But yeah, I want to get $33,000 in 3 weeks to buy an RV, to travel the edges of the map, and at the same time provide free medical guidance and surgical advice and guidance, healing to anybody that I come across. And I want to share my knowledge on every way, and I accept any help that is given my way. So thank you so much. I love you.